Well, thank you so much for having me today. Again, my name is Faviola Lopez. I use she, her pronouns, and I am the Regional Organizing Director for Planned Parenthood of Greater Washington and North Idaho. Next slide, please. So today we're going to be talking about a little bit about our mission and our history as an affiliate, the services we provide, our role in Washington and Idaho as well, because we do serve North Idaho, and what abortion access currently looks like in the U.S. as well as Washington State. We have reserved some time at the end for question and answer, but if you have any questions or concerns, feel free to just stop me and ask your questions. Next slide, please. So, Planned Parenthood of Greater Washington and North Idaho, which we will be referring to PP Gwinny or Gwinny for the sake of time today. Our mission is to provide exceptional health care, honest education, and fearless advocacy for all, with a vision to make sure that our community members have the tools and resources to plan for their future and to make sure that they are healthy on their terms. We really see our mission as a three-legged stool with our services, education, and advocacy as three pillars. We really need all three to stand on, and we know that if we were to not focus on one, our three-legged stool model will fall. So we try to focus on all three to best help our community. Next slide, please. So just unpacking our mission a little further, it has three components, which is our direct health services, which of course help address our community's immediate needs. This is very important to us because we know that medical bills are the leading cause of bankruptcy in the U.S., especially with our community members who are uninsured. Our honest education helps to provide individuals with the knowledge they need to take care of their own health based on their personal values. And of course, our goal with our advocacy work is to ensure that the systematic barriers that unfairly target women, people of color, immigrants, and our LGBTQ community are removed. And we know that this is only possible by fighting for solidarity issues such as immigration, police accountability, environmental issues, and affordable housing, just to name a few. Next slide, please. So a little bit about PP Gwinny's history as an affiliate. There are close to 50 affiliates throughout the United States. PP Gwinny covers the majority of Central and Eastern Washington, as you can see. The rest of Washington State is split up amongst two different affiliates. So that would be Planned Parenthood of the Great Northwest and Planned Parenthood of Bellingham, which is way up in the corner. So our affiliate was first, the beginnings of it started in 1966 when a steering committee was formed in Yakima County after the need for family planning services was a topic of discussion in a very packed Yakima Kittitas unit of the Washington Association of Social Issues. And our affiliate was formed the very next year in 1967 when we provided direct services to patients in Yakima, which means we have now been serving Central Washington for 55 years. Later on, the following year in 1966, our affiliate also began offering services in Spokane County. We were able to open up our Sunnyside location in 1969, and in 1970, a few years before Roe v. Wade, Washington State voters actually passed Referendum 20, which legalized abortion in the first trimester in Washington State. The following years, in 1980, we were able to open up our Richland location. And 5 years later, we followed with our Spokane Valley. The following year, we were able to open up our Pullman clinic. And in 1889, we were able to open up the Pasco Clinic. And here in Ellensburg, we were able to open up this clinic in 1990. Although some of you may remember it was in a different location. We are now on Pine, just a few blocks away. And then in 1991, we were able to open up our Kennewick location. And again, now we are able to serve 11 different sites amongst Central and Eastern Washington. Next slide, please. So these are some of the services we provide. The majority of our services are actually just contraceptive information, as well as STI testing, treatment, and family planning. But as you can see, we provide everything from birth control down to behavioral health. We are really excited to be able to expand on our primary care with the hopes that we can help patients who may not be able to go to community health centers. As we know, they are many times overwhelmed with low-income patients as well as uninsured patients. So we hope to expand to primary care soon. I believe right now we are offering those services in Yakima and Spokane, but to help with our rural patients, we hope to expand to Ellensburg, Pullman, and Walla Walla, which are specifically our college, youth, university locations. Are there any services here that you are all surprised to see or didn't know that we offered, or have any questions about now that they're up on the screen?
I didn't know you included behavioral health. That's really great and interesting.
Yes, the behavioral health actually came about when we started our hormonal services so that our patients could receive a lot of those services must be accompanied with behavioral health. And so we are also working to have a licensed behavioral health specialist at all of our locations so that we can continue providing general behavioral health as well as those hormonal treatments that everybody needs. Any other questions about our services before we move on? All right, next slide, please. In addition to each of our, to all of those services you saw, we are very proud to provide intimate partner violence screening at every visit. We want to make sure, again, that our patients have education along with their health care at every visit so that they can remain healthy. We also provide intensive patient education with everything to family planning, to how to talk to your partner if you have a positive STI result. We also help our patients sign up for insurance, Medicaid, and financial programs if they happen to need that help. And also recently, because of the pandemic, we have expanded our telehealth services. This is one of the major pushes that we are trying to move forward with so that we can really help our patients in those rural communities and they can receive our help right from the comfort of their homes. And again, and also, I'm sorry, we also provide referrals to other networks and organizations, including adoption agencies, and really any agency that needs, that our patients need. We are very proud to provide that counseling and make sure that our patients receive care, whether it's with us or with anyone else that they may need. Next slide. We are very proud to be known as a safety net provider, which means that we never turn anyone away because of inability to pay, and we also never send our patients to collection agencies, which is why we try so hard to receive that funding so that we can help all of our patients. We also accept all forms of insurance, including private and Medicaid. So for a lot of our folks who want to support Planned Parenthood but don't know how necessarily to, we like to say, if you can receive any of our services with us, please do so, because your private insurance helps us supplement those patients who don't have private insurance, because reimbursements are much higher for private insurance than they are for Medicaid. We also work on a sliding scale for family planning services. So based on how much our patients make, they can pay up to $0 for birth control. And we are also happy to provide $7 million each year for free and reduced costs, because all of the money, because we are a nonprofit, all of the money that we receive, whether it's reimbursed from our government or from our private donors, gets recycled back into our patients to help those who cannot pay for their own services. And in a lot of our service area, we're the only providers for our patients because, again, a lot of the community health centers are overwhelmed with patients and they're not accepting new patients a lot of the time. So we want to make sure that if our patients, even, again, those who have private Medicaid, I had an experience where I had a medical issue, which to me was very urgent, but my primary care doctor couldn't see me for 5 days. So I got to go and have my services provided at Planned Parenthood because they do not require people to be patients to be seen.